Hello, everyone. My name is Anne Marie. I'm with John Boyd and Associates. If we hadn't had a chance to meet yet, it's very nice to meet you. As many of you know, Diane has retired, so I'll be the one helping you move forward with your Medicare plans. I'm really looking forward to working with each and every one of you and making this transition as smooth as possible. Today, we're going to be talking about the changes coming to the Blue Cross Blue Shield PPO Essential Plan. So if you're currently enrolled in that Blue Cross PPO Essential Plan, this presentation is definitely for you. I'll be walking you through what's changing from 2025 to 2026 and what those updates mean for you. Now, I'll mainly be focusing on the areas that are changing. If I don't mention a specific benefit or section, that simply means it's staying the same from 2025 to 2026, so no need to worry about those details. It would be impossible to go through every county in Michigan, but the majority of people I assist are in Region 6, which includes Macomb, Oakland, Washtenaw, and Wayne counties. If you're outside of Region 6, don't worry, your monthly premiums are also listed here on this slide, so you can see what applies to your area. Unfortunately, for Region 3, this plan will no longer be available in 2026. So if you live in Region 3, your plan will not automatically renew for next year, and we'll need to review new plan options together for 2026. So let's start with inpatient hospital stay. This is actually one of the positive changes coming for 2026. So in 2025, the cost for an inpatient stay was $420 per day for the first 7 days. In 2026, that amount is decreasing to $350 for days 1 through 6. So that's a nice improvement in your out-of-pocket costs if you ever need a hospital stay. Now we're going to talk about your prescription drug coverage or your Part D. In 2025, that amount was $0. That there was no deductible on your plan in 2025. In 2026, they are adding a $150 deductible on tiers 3, 4, and 5 until you reach your yearly deductible. So while your hospital benefit is improving, there will now be a small deductible added to your prescription drug coverage starting next year. This slide shows changes for individuals using standard retail and standard mail order pharmacies, as well as network long-term care and out-of-network pharmacies. First, it's important to remember that no matter what tier your insulin falls under, you'll never pay more than $35 for a 1-month supply of each covered insulin product. So when I'm going through this, please know that. First, we're going to start with Tier 2 medications. The cost is decreasing from $20 down to a $10 copay. That's great news for anyone taking generic or preferred brand medications commonly used for maintenance care. Tier 3 was a $47 copay. It is now going up to a 20% coinsurance, meaning your cost will vary depending on the price of the medication. Tier 4, this one's the biggest improvement. The cost is going down from 50% coinsurance to a 25% coinsurance, cutting the out-of-pocket expense in half for many higher tier medications. Tier 5, there's also a slight decrease going from a 33% coinsurance down to a 31% coinsurance. While smaller, this still means a little extra savings at higher tier medications. This slide applies to individuals using a preferred retail or preferred mail order pharmacy. Again, it's important to remember no matter what tier your insulin falls on, you'll never pay more than $35 for a 1-month supply of each covered insulin product. So for drug tier 2, it is going from a $11 copayment to a $5 copayment. So also great news for anyone taking preferred generic medications. Tier 3 is changing from a $42 copayment to a 20% co-insurance. So your cost will now depend on the price of your prescription medication. Tier 4 is improving from a 50% co-insurance to a 25% co-insurance, cutting your share in half for many higher cost medications. And Tier 5 is going to be going from a 33% co-insurance to a 31% co-insurance. These updates mean lower out-of-pocket costs overall, especially for commonly used generics and many higher tier medications. Let's take a look at a couple of important changes for 2026. For ambulance services not requiring transportation to a facility, this was previously a $90 copayment in or out of network. In 2026, if you are in network, it's also going to remain $90 copayment, but if you are out of network, it's going to be 50% of the approved amount for an ambulance service not requiring transportation. Also, chiropractic was covered in network at a $45 copayment in 2025, and in 2026, you are not going to have this benefit. So now we're going to look at dental services as well as diabetic supplies. There's a few changes here as well. In 2025, Blue Cross provided a $1,500 annual maximum for a combined in and out of network dental services per calendar year that covered both preventative and comprehensive services. For 2026, this amount is decreasing to $950 per calendar year for the same combined in and out of network dental services. Now we're going to talk about the diabetes self-management training, diabetic services, and supplies. If you are in network in 2025, there was a $0 copayment. Now in 2026, there's a 0% coinsurance for preferred diabetic supplies. If you have non-preferred diabetic supplies, there will be 20% of the approved amount. Also, if you are out of network in 2025, it was a $0 copayment, but being out of network in 2026, there will be a $0 coinsurance for the preferred diabetic supplies and 40% of the approved amount for non-preferred diabetic supplies. Lastly, for Medicare covered shoes and inserts in 2025, there was a $0 copayment, but in 2026, that will change to a 40% of the approved amount for Medicare covered shoes and inserts. This slide is in regards to the buy-up dental and vision option that was available with this plan. In 2025, the cost for this added coverage was $21.80. And now for 2026, that amount is increasing to $30.50. So if you choose to keep the enhanced dental and vision benefits, just note there will be a slight increase to your monthly premium for that add-on. Let's review a few additional benefit changes for 2026. For emergency care, the copayment is increasing slightly. It's going from $125 in 2025 to $130 in 2026. In 2025, the plan also included silver sneakers at a $0 copayment, giving you access to fitness programs in participating gyms. However, in 2026, silver sneakers will no longer be included with this plan, meaning that the fitness benefit is not covered or not available with this plan any longer. For hearing services in 2025, you had coverage that was included, but in 2026, this plan will no longer include any hearing benefit in this plan either, so it has been removed. Now we're going to be looking at the meal benefit as well as the Medicare Part B prescription drugs. So the meal benefit that was included in 2025 has been removed for 2026. So that is no longer included in this plan. And for the Medicare Part B prescription drugs, before there was coverage for Part B drugs is not subject to step therapy requirements. That is and now in 2026, they may be subject to step therapy. So I just want you to be aware of that change from 25 to 26. So let's review the changes to your outpatient hospital and rehabilitation services, as well as your over-the-counter benefits. For outpatient hospital observation in 2025, there was a $0 copayment. In 2026, there's now going to be a $130 copayment that is being added for in-network hospital observation stays. For outpatient hospital services, there was a $150 copayment. That's for anything outpatient hospital with no surgery. That is now going to be reduced to a $125 copayment as long as you're in network and there's no surgical services in an outpatient hospital setting. For outpatient rehabilitation services, including OT, PT, speech therapy, and you're in network, the copay is going from a $40 copayment to a $45 copayment. And lastly, one more significant change, the over-the-counter benefits that everyone loves. It was $95 per quarter in 2025, and they have removed that in 2026. So that means this plan will no longer include any OTC allowance moving forward. This slide looks at the changes related to dermatology, specialist visits, skilled nursing facility care, and some benefits that are being removed for 2026. So for in-network dermatology in 2025, there was a $50 copayment for a full body skin exam performed by a dermatologist once in a lifetime. In 2026, that will be decreasing slightly to $45, so that's a small but positive change. For in-network surgical procedures performed by a specialist in the specialist office, there's a $50 copay. That is decreasing to $45. There was a $150 copayment for any outpatient hospital non-surgical services is also decreasing to $125 in 2026. And now if you receive a full body skin exam out of network, the change is more significant. So in 2025, the cost was $50 copayment, and now it's going to be 50% of the approved amount for a full body skin exam performed by the dermatologist, which could result in a higher out-of-pocket cost if you go out of network. So moving on to skilled nursing care, for days 21 through 100 in 2025, the copayment was $214. That is slightly increasing in 2026 to $218. As an additional plan benefit in 2025, members with some chronic conditions could have used their $95 quarterly allowance to purchase food or produce. And since the OTC benefit is being removed in 2026, that option will no longer be available. And finally, in 2025, there was no copayment for transportation, which allowed one round trip. For 2026, they are also removing that transportation benefit, so that is no longer included with this plan either. For vision care in 2025, the plan provided $150 combined in and out of network, and that benefit was once a calendar year, could be used for contacts or a frame. And in 2026, that vision benefit has been removed, meaning this plan will no longer include any vision coverage moving forward. I just wanted to include this slide to point out the fact that Blue Cross has mentioned that they have made changes to the drug list this year. So I just want you to be aware that this is exactly why I review your plans going into 2026 to make sure your doctors are still in network and your prescriptions remain on the formulary for your plan. So if you decide to keep your plan and let it roll over into 2026, I want you to ensure that everything you need, including your medications, is still covered the way that it should be. This slide reviews how your prescription drug coverage works for 2026 and also introduces a helpful program called Extra Help. So we're going to start with the three drug coverage stages. Stage 1 is going to be that yearly deductible. So on this plan, I had mentioned that the drug deductible for 2026 is $150, and that is on the tiers 3, 4, and 5. So you'll pay the full cost of those prescriptions until you meet that deductible. Then it brings you to stage 2, which is called the initial coverage. After meeting your deductible, you move into the initial coverage stage. And in 2025, the annual maximum out-of-pocket limit was $2,000. So for 2026, that amount has slightly increased to $2,100. So that means if your prescriptions are on the formulary, you will not spend more than $2,100 for the year on your covered medications. And then stage 3 is the catastrophic stage. Once you reach the $2,100 limit, you move into the catastrophic phase where you will not pay anything further for your covered prescriptions for the rest of the year. Now, if you feel that your prescription costs are too high, you may qualify for a program called Extra Help. And Extra Help is a Medicare program that assists people with limited income and resources by reducing their Part D prescription drug costs. So you do not have to be low income to be approved for this program. So here are a few important details about the program. Your eligibility depends on your income and your resource limits, which are updated annually. If you're approved, Extra Help can lower your monthly prescriptions and reduce out-of-pocket prescription costs. And you can apply online through the Social Security Administration, which I've listed the website that you go to right on this page. Once you apply, you'll receive a notice decision from Social Security. If you're approved, your drug plan will automatically adjust the costs, and your benefits typically last for about a calendar year. So you may have to reapply in the next year. Social Security will also notify you each year if you need to renew your benefits. If you'd like to see if you qualify or would like assistance with the application, please let me know and I'll be happy to walk you through the process. This slide is about the Medicare prescription payment program, which is designed to help people manage high upfront prescription costs at the start of the year. So if you go to the pharmacy in January and they tell you your prescriptions will cost a large amount at once, do not panic. You don't have to pay that entire amount right away. This program allows you to divide your prescription drug costs evenly over 12 months, so you can make manageable monthly payments instead of paying everything up front. So if your prescriptions are, say, $100 in January, you do not need this program at all. It'll actually end up costing you more in December if you do it that way, because they're going to keep tacking on money to the end of the plan. But if you go to the pharmacy in January and they tell you all $2,100 is due, then you can opt into the Medicare prescription payment program instead of paying that full amount immediately. This program will spread those costs evenly over the year, making it easier for budget. Also, if you're already participating in staying with the same plan for 2026, you'll be automatically renewed for next year and you don't have to do anything. But if you're currently not enrolled but would like to participate next year, you simply let your pharmacist know that you're interested. Your pharmacist will contact Blue Cross Blue Shield on your behalf. You'll then receive a monthly bill from Blue Cross showing your partial payment amount for your prescriptions, and you'll continue to receive that notice each month to make your payments directly to Blue Cross. You won't be paying to the pharmacy, you'll be paying to Blue Cross directly. So this is a great option to make prescription costs more manageable throughout the year instead of paying one large sum all at one time. So this brings us to the end of the presentation. I hope you enjoyed this new video format and found it helpful to see all your changes laid out visually in front of you. I'd love to hear your feedback, so please let me know what you thought of seeing this information presented this way. And so now it's your turn to decide what you would like to do for 2026. If you are comfortable with all the plan changes to this current plan and you would like to stay where you are, just send me a quick email letting me know that you're okay with staying with this plan for 2026, and you'll be all set. That plan, the plan will roll over. If you'd like to see other plan options, I've already attached a comparison sheet for you. It includes options that may allow you to stay with Blue Cross or switch to another carrier, whichever offers the best fit for your doctors and prescriptions. I've already done the work to check that your doctors and your prescriptions are on formulary and in network. So, you know, the prescription medications may vary a little from plan to plan, but I'm confirming that you'll be paying the lowest cost possible for your prescription medications. If you see another plan that looks like a better fit, the next thing that you need to do is you're going to click on my Calendly link that's going to be included in this email. The link will show you my available dates and times, and then you can choose what works best for you. Once you schedule an appointment, I'll call you at that time you selected so we can go over your plan options, or I can answer any questions that you might have. So I'm really looking forward to talking with each and every one of you, and I appreciate you taking the time to review your plan updates for 2026. I hope you all have a great day, and I'll talk to you soon.